use of opioids for either medical purposes or recreational reasons can sometimes develop into opioid dependence. Many people don't know that opioid dependence is a medical condition that affects millions of people like you, or that genetic factors and prolonged use of opioids may predispose a person to dependence.
That explains why I just can't stop. I mean, even though I want to, I really just feel so ashamed.
No, there's nothing to be ashamed of.
Many people don't know why they are unable to stop using opioids on their own. It's important to recognize that opioid dependence is a medical condition that can be treated with a comprehensive regimen that includes both medication and counseling.
Severe withdrawal symptoms and strong drug cravings can trigger continued use and make it virtually impossible to stop using opioids without medical intervention. In fact, opioid dependence is considered a brain disease because of the way opioid drugs change the functions of the brain.
Is there a way to treat this condition but keep it confidential?
Yes, there is. There's a medication called Suboxone that can be prescribed for you right here in the privacy of my office. Suboxone can be picked up at the pharmacy and taken at home like any other medication. Suboxone enables people to stop using other opioids and remain in treatment by suppressing their withdrawal symptoms and decreasing their cravings.
So how do I know if Suboxone is a good choice for me?
Suboxone's been effective in treating people with opioid dependence, and I believe it may be an appropriate option for you. We can begin treatment and see how you respond. Doug, I want to introduce you to my nurse, Kathleen. She'll review Suboxone therapy and answer any questions you may have. I'll see you later.
Hi, Doug.
Hi.
So, how you feeling today? So, do you have any concerns about starting treatment with Suboxone?
Yeah. I'm really scared of going into withdrawal.
That's understandable. Some patients even postpone seeking treatment because of the fear of withdrawal. As long as you are in mild to moderate withdrawal when you come in for your first visit, you should begin to feel relief about 30 to 60 minutes after you take the first dose of Suboxone.
If you have high levels of opioids in your system when you begin therapy, the Suboxone molecules may displace other opioid molecules in your system and lower the overall opioid effect too rapidly, potentially causing more severe withdrawal. To prevent this from happening, it's important that you are in mild to moderate withdrawal prior to your first dose.
But what if I still don't feel well after taking Suboxone?
That's a possibility because Suboxone impacts people differently. We'll adjust your dosage over time until you feel comfortable. It's very important for you to be open and honest with us during all of your office visits so that we can give you the best treatment possible.
But I don't like to talk about my drug use.
I understand, Doug. I want you to know that the information you share with me will only be used to help us create the best treatment plan for you and keep you on the path toward success.
Many patients feel embarrassed about their opioid use, but your doctor and healthcare professionals recognize that opioid dependence is a medical condition and will not judge you or your history of drug use.
Although it's not easy, you need to be completely open about your drug use and any family history of drug dependence or alcohol abuse in order to help us treat you appropriately.
Your healthcare professional understands that opioid dependence is not a moral failing, but a true medical condition that requires medical attention. You'll benefit from providing your medical team with all of the facts.
Is there any history of drug or alcohol use in your family that you can share? I'm also interested in hearing about your own personal history of drug or alcohol use.
Actually, I'm pretty sure my grandfather was an alcoholic. And I started abusing prescription painkillers about 2 years ago. And recently used heroin. I've tried to stop 6 or 7 times, but I've always gone back to using because I couldn't stand the withdrawal.
Being candid about past attempts to stop using drugs and discussing techniques that were helpful for you can make it easier for your healthcare professionals to tailor treatment specifically to your needs. A strong support system is important to your treatment success and the process of recovery. Your doctor can also direct you to counseling support in your area.
Have you discussed your treatment with your family and friends?
Yes, I have. My wife and my brother have agreed to support me through this.
Well, great. Now we can truly determine the best course of treatment for you.
Can you tell me how Suboxone works?
Well, that's a great question. Let's take a look at Suboxone in action.
Opioids attach to mu-opioid receptors located in several parts of the brain. The mu-opioid receptors are located on the nerve synapses shown here. Opioids, which are represented as orange spheres, bind to the opioid mu receptors, shown here as red circles. As they attach, receptors begin to release dopamine, which is represented as the glowing yellow plus symbols. Dopamine release is responsible for producing pleasurable feelings or euphoria, referred to as a high. As opioids leave the receptors, the pleasurable feelings begin to fade. The black minus symbols represent the loss of opioid effects that result in withdrawal symptoms, which may begin at this time. Cravings may also start to occur at this time. As the opioid continues to leave the mu receptors, the patient may progress to a mild to moderate state of withdrawal. At this point, Suboxone therapy can begin. While the other opioid continues to leave the person's system, Suboxone attaches to the mu receptors and restarts opioid activity in the brain, producing less euphoria than full opioid agonists, but sufficient to suppress withdrawal and cravings. The buprenorphine in Suboxone bonds more strongly to the receptor than full opioid agonists, such as heroin, hydrocodone, methadone, morphine, and oxycodone at an equivalent dose. At adequate maintenance doses, buprenorphine fills most receptors and blocks others from attaching. Buprenorphine has a long duration of action, so its effects do not wear off quickly.
You should know that Suboxone produces limited pleasurable feelings compared to what you may have experienced from opioid painkillers that were prescribed for you. This should make it easier to focus on other aspects of your treatment and recovery process.
Can I take it wherever I am?
Yes, you can. After you're stabilized, I'll give you a prescription for Suboxone to fill at the pharmacy, just like any other prescription. We'll also set up regularly scheduled visits for you so that we can monitor how your treatment is progressing. In the meantime, counseling will help you focus on other aspects of your life.